Hi, welcome to the Nurse Preceptor channel on YouTube. I'm Hillary and I'm your Nurse Preceptor. For those of you who have never seen my videos and who are new to my channel, I am a registered nurse for 21 years. I'm also a pediatric nurse practitioner and I am a certified emergency nurse. And today I'm going to talk about a topic that I've come to know pretty well, and this is the topic of Osgood-Schlatter's disease. What is this, right? If you've never heard of it, it's something new. Anyone who is familiar with pediatrics and orthopedics probably has heard of this before, and you've probably seen it a few times. Osgood-Schlatter's disease is a condition that's mainly characterized by knee pain that worsens during physical activity. The most common ages for this are your people who are prepubescent and during puberty. And this is because during periods of growth, the bones grow very quickly, and the muscles that are attached to the bones by tendon take a little bit longer to stretch to accommodate the new bone growth. And so under normal circumstances, if you have a kid who's maybe not very active, they still may experience some growing pains in their knees and their legs especially. But kids who are very, very active, like competitive athletes, kids that run and jump, especially people who are involved in sports where there is a lot of jumping and a lot of intense physical activity, they are very prone to getting this pain. The pain is located right over the tibial tuberosity, which is the knobby part of the upper shin bone. Okay, right under the kneecap. And usually the pain is only on the shin bone. It's not in the knee, it's not in the tendon, and there are no really specific physical findings except that they a lot of times have some pain if you press on that part of their bone. The pain usually worsens during physical activity and gets better with rest. It doesn't cause any long-term problems. It can possibly cause a little bit of bone callousing, but typically this resolves as soon as their growth spurt is finished. So it's time limited by nature, it's temporary, but it is painful. I had this myself when I was a kid. My brother also had it, and it can be very, very intensely painful for that year or so that you're going through your major growth spurt as an adolescent. So let's talk about what to do about it. So as far as management, no x-rays are necessary, and typically it's just a physical exam that the diagnosis is made. They get a good history about what's causing the pain, when does it worsen, when does it get better, and where exactly is it located. Usually no other physical findings other than the pain, possibly a little bit of swelling over that tuberosity or the knobby part of the bone right under the knee. And so what do we do about it? It's actually pretty simple. It's RICE, rest, ice, compression, elevation, and I would also add anti-inflammatories and pain management in there. So anti-inflammatory treatment for kids would be ibuprofen at a dose that's appropriate for their age and weight. You can also use acetaminophen or Tylenol as an adjunct pain medication, but the anti-inflammatories are probably going to give you the best result because they take the inflammation down and help with the pain. The other things I'm talking about is rest, ice, compression, elevation. Of course, kids that are competitive athletes aren't going to stop doing their athletics, but you might want to advise them to limit the amount of extra jumping and running that they're doing outside of their physical training. They need to give themselves enough time to rest and heal and recover. Ice is very helpful. Ice directly over the knee joint, 20 minutes on, 20 minutes off. Repeat this a few times during the day as they are able. Compression is actually in the form of a strap. And in this case, it is just a knee strap. You can buy them at drugstores, and if you have a very petite child, you might actually find that an adult elbow strap is very helpful. It's a simple band of snug material that can be adjusted with Velcro, and you place it right over the tendon between the kneecap and the tibia. This is an example of the strap that I'm talking about. And then elevation, just keep it elevated some while they're resting. Just as they're watching TV, have them kick their leg up and let some of that swelling go down. All right? And just keep reinforcing to them this is something that is very time limited. It is not permanent. And strengthening the quadriceps and doing some additional stretching may be helpful for these kids. So quadriceps stretches are something they can learn to do very easily. I'll demonstrate one here so that you can see how to teach these kids. I apologize for the quality of the video. I'm filming on the road today, but what you want to have the kid do is hold on to something steady and kick their heel up so that it hits their butt cheek, kind of like this. Keep their quad aligned in a straight line with their torso, and you just want them to pull up gently to the point of stretch, but not past the point of pain. All right, and just hold the stretch 20 to 30 seconds. And then that's a very good quadricep stretch. If you have additional questions about this topic, I would refer you to the Mayo Clinic's website. You can just type it into a search engine and get the Mayo Clinic, and you can search for almost any medical condition. And they tend to have information that's really easy to read, and you can pick what part of it you're most interested in learning about, whether it's the physiology behind it or the treatments for it. Okay? And the other thing is, if you have additional comments or questions, please leave them in the section below. Leave them in the comment section. And please like and subscribe and share this video if you find that it would be helpful to someone who you know. All right? This is Hillary, the Nurse Preceptor, signing out. Thank you. Bye.